Hey there, welcome back to Baby Feeding USA. If you're new here, hit that subscribe button and turn on notifications so you don't miss any of our baby feeding tips and real-life parenting advice. Today we're diving into something that many new moms deal with but don't always talk about: engorged breasts while breastfeeding. What does it mean, why it happens, and most importantly, how do you manage it without losing your mind? Let's get into it. Section 1: What is breast engorgement? So, what exactly is breast engorgement? Basically, it's when your breasts become overly full of milk. They can feel hard, swollen, warm, and really tender. Some moms even say it feels like their breasts are going to burst. Ouch, right? It usually happens in the early days of breastfeeding, especially when your milk first comes in around day 3 to 5 after birth. But it can also happen later on if you suddenly skip feedings or your baby starts nursing less. Section 2: Why does it happen? Here's the deal. Your body is trying to figure out how much milk your baby needs. At first, it overproduces. That's normal. Your breasts get full, and if that milk isn't removed by nursing or pumping, it backs up, causing swelling and pressure. Other things that can lead to engorgement include missing a feeding, your baby sleeping longer than usual, weaning too fast, a poor latch, so milk isn't being removed efficiently. Section 3: How to tell it's engorgement, and not something else. Okay, so how do you know it's engorgement and not something more serious like mastitis? Here's what to look for. Breasts feel firm, swollen, and hot. You may see some redness but no fever. It's painful but not unbearable. It usually happens on both sides. If you have a high fever, chills, or your breast is red and hot in one specific area, you might be dealing with mastitis, and that's when you should definitely call your doctor. Section 4: Tips to relieve engorgement. Alright, now to the good stuff. Here are 6 ways to manage and relieve engorgement safely and naturally. 1. Nurse frequently. Feed your baby often, about every 2 to 3 hours. Don't wait until your breasts are rock hard, get ahead of it. 2. Make sure baby latches well. A poor latch can make things worse. Try different nursing positions and make sure your baby is latched on deep. A lactation consultant can really help if you're struggling with this. 3. Express a little milk before feeding. If your breast is too full and firm, your baby might have trouble latching. Gently hand express or pump a little milk to soften the areola before nursing. 4. Use cold compresses between feedings. Cold helps reduce swelling. A bag of frozen peas wrapped in a towel works great. Apply it for about 15 minutes between feeds. 5. Use warmth right before nursing. A warm shower or warm compress can help your milk flow before feeding. Just don't use heat too much, it can increase swelling if overdone. 6. Gentle breast massage while nursing or pumping. Gently massage your breasts in a circular motion. This helps move the milk out more effectively and relieve pressure. Section 5: When to call a doctor. If the pain gets worse, your breasts feel lumpy in one area, or you spike a fever, don't wait. That could be a sign of clogged ducts or mastitis, which needs medical treatment. Always listen to your body. If something doesn't feel right, trust your gut and talk to your doctor or lactation consultant. OUTRO, breast engorgement is super common, and yeah, it's uncomfortable, but the good news is, it usually gets better as your body and your baby get into a rhythm. You've got this, mama. Biceps. And remember, every mom's journey is different. Be kind to yourself and take it one feeding at a time. If you found this video helpful, don't forget to give it a thumbs up, subscribe to Baby Feeding USA, and share it with a fellow mom who might need it. Drop your questions in the comments. I love hearing from you all. Until next time, happy feeding, sparkling heart.